Good evening and welcome to the COVID-19 update on Channels Television. I'm Millicent Nwaka. Here are some of the highlights this hour. Ahead of the Eid al-Kabir celebration, travellers face strict enforcement of COVID-19 safety protocols at the Idu rail station in Abuja. Inspector General of Police asked Nigerians to voluntarily obey ban on mass gatherings as they celebrate Eid al-Kabir. And the death toll in the U.S. rises to more than 150,000 as states of California, Florida and Texas all set one-day records for COVID-19 deaths. Today marks 6 months since the WHO declared the coronavirus pandemic a public health emergency of international concern. At the time the health body made the announcement, there was no coronavirus cases on the African continent. Now there are almost 900,000. According to the WHO Regional Director for Africa, Dr. Mashidiso Moeti, the continent must increase its testing for the virus in Africa, especially as countries ease the lockdown measures and the number of confirmed cases increase. According to her, authorities, communities need to have capacity in place to react quickly and comprehensively with strong surveillance, testing, isolation and contact tracing. South Africa, a country of about 58 million people, has already conducted over 2 million tests. A pooled testing approach is being used in Ghana, combining samples from multiple people and testing them together to increase testing capacity. While in Nigeria, about 6 states and the FCT have so far tested over 10,000 cases of COVID-19. The states are Lagos, the FCT, Kano, Oyo, Edo, Kaduna, Plateau, while other states like Rivers, Borno, Ogun, Gombe, Delta, Katsina, Bauchi have conducted less than 10,000 tests, but over 5,000 tests in each. Total samples tested nationwide stand at 276,053. Nigeria recorded 404 new confirmed cases and 5 deaths last night. The deaths were recorded in Kwara, 3, 1 case in the FCT and another in Ondo State. Till date, 42,208 cases have been confirmed and 19,004 cases have recovered, while a total of 873 deaths have been recorded in 36 states and the FCT. The new cases are reported from 19 states and the FCT, Lagos recording 106, other states as well, like you have Ondo 15, 10 in Ogun, 8 in Kaduna, Cross River recorded 5 as well, and other states across the country. The proportion of confirmed cases over the total in the WHO African region leaves Nigeria at 5.69%. The virus attack rate is 20.18 per 100,000 people. Reported transmission remains community spread in the country. Ahead of the Eid al-Kabir celebrations, there appears to be a low turnout of passengers travelling from some motor parks and the train station in Abuja to other parts of the country. A visit to the Idu rail station in Abuja and the park saw a low turnout, which might be ascribed to the preventive measures to avoid large gatherings, one of the coronavirus safety protocols. And this is when you compare it to the same situation in previous festive periods. Take a look.
The Utako Motor Park and the Idu railway station are popular exit points for people traveling out of Abuja, especially during the holiday seasons. It does appear, however, that the outbreak of COVID-19 is affecting the number of travelers who use these exit points during this year's Eid al-Kabir holiday. Passengers trickling in and out of the Utako Motor Park and the Idu railway station in Abuja. Not much attention is paid to the COVID-19 safety protocols at this motor park. The situation is, however, different at the Idu railway station as officials try to enforce strict compliance with the COVID-19 safety protocols.
COVID-19 is real and most passengers this morning know that fact. Even though we cannot say all really complied, but one thing we do is to make them realize how important to be here to observe all the COVID-19 protocol that we have laid down for our passengers as soon as you arrive at the train station. And there is a high level of compliance I have observed this morning.
The sitting and boarding arrangements at this terminal allow physical distancing, which also comes with a cost. But the fare alone is not what some passengers consider when choosing a means of transportation.
Most of us follow the train because of the perceived safety associated with it compared to going by road because of all these incidences that are happening. So I think it's comfortable, and considering also the dynamics that COVID-19 now added to the whole experience, you could see that the seat has been spaced, like just me sitting here. And where ordinarily 3 people are sitting, we have 2 people now. So it's okay. The experience is okay.
The train management as an railway corporation are doing their best, especially in this COVID-19 matter. When you see the social distance and a lot of security guard here. So it's very impressive.
Transportation fare from Abuja to Kaduna by rail was increased by almost 100% as the government resumed rail operations on Wednesday, July the 29th. COVID-19 is a viral disease that is easily spread from person to person. Hence, it is important that people comply with the health safety protocols as they travel for the holiday.
Meanwhile, the Inspector General of Police, Mohammed Adamu, has called on citizens to obey the ban on mass socio-religious gatherings and other prevention orders directed at protecting them and checking further spread of COVID-19 in the country, while congratulating the Muslim faithfuls in the country as they join other Muslims across the world to celebrate. He enjoins them to cooperate with the police, noting that the measures have become imperative due to the raging pandemic. In a statement through his spokesman, the IGP directed the commissioners of police in all the states of the Federation, the FCT as well as their supervisory assistant inspectors general of police in the 17 zonal commands to intensify confidence-building patrols, particularly on major highways and around critical national infrastructure. Now, at the Sir Abubakar Tafawa Balewa International Airport, Bauchi State, domestic air operations have resumed. The first flight left Abuja to Bauchi today, Thursday. Here's our correspondent Hajar Ali with this update.
The first flight to resume commercial operations at the Sir Abubakar Tafawa Balewa International Airport, Bauchi, touched ground at 3:20 p.m. It was welcomed by the fire service demo, being the first flight to resume operation after 4 months of non-activity. Most of the passengers that have arrived today are those that have come for the Salah holiday. The flight had 85 passengers on board, and they had to undergo safety protocols on arrival.
Immediately you land, you can see that everything is organized. The protocols are being enforced, and everything is going as it should be. So I'm satisfied. I feel safe.
Enough has been done, but maybe the challenge will come when a lot of passengers come to the airport. That is the issue of social distancing. If you have too many passengers, the facilities may be overstretched. But as it is, knowing that COVID-19 has made air travel something of a special luxury now, we may not see that kind of huge traffic for some time. So I believe it will be gradual before it picks up.
The Sir Abubakar Tafawa Balewa International Airport is not usually a busy airport. The passenger traffic is less. There are only 9 persons traveling back to Abuja from the Sir Abubakar Tafawa Balewa International Airport. Hajar Ali for COVID-19 update.
For more on flattening the curve, Dr. Kemp, and she's the co-chair of the Health Sector Reform Coalition and CEO of Preston Associates for International Development. She joins us from our Abuja studios. Thank you for joining us on the program.
It's a pleasure to be here.
Now, Dr. Ene, you've been involved in the pandemic response for some time. What's your assessment of the priorities for government as it combats the rising case of COVID-19?
Well, I would say that the two top priorities would be testing. It's important that we test more people. Currently, we have 272,000 being tested out of a population of 206 million. That's about 1.3%. That's nowhere near the recommended first milestone of testing, which is 10%. And then, of course, it needs to go higher. So without really getting a real sense of what's happening in the country, it's difficult to say whether the government is doing a good job or not, or whether, we're approaching the curve, or whether we're flattening the curve. We don't really know, because right now, we haven't tested enough people. Then I would say the second priority is really about messaging. The messaging needs to be effective really at the grassroots, because we're seeing that while those in urban centers may have heard over and over about the COVID virus, in the hinterlands, in the rural areas, hard to reach areas, that's not the case. Some people don't even believe that COVID exists. So I would say that messaging is a big part of what the government really needs to be coordinating at this point. Thank you.
In monitoring the efforts of government, looking at the percentage of the high number of unknown exposure of the virus in our communities, is there a possibility that the virus was already in the country before our first confirmed case in February?
The thing is, once the first case was identified, when the cases were identified in China, I think our government did kick into gear. I think the head of this NCDC was quick to kind of raise the alarm that Nigeria could be next. So I think there were some systems in place at the airports, and the first case that we had, which was actually not a Nigerian national, but somebody who was coming from Europe who was working here, and we were quick to, at least they were quick to identify this individual, have him confirmed as a COVID case, and all the protocols for surveillance and isolation treatment were just kicked into gear immediately afterwards. So it's true, there's an incubation period of about 14 days. A lot could have happened before that. It's possible that other people who went to China came in but just didn't make themselves known to authorities. But where we are now, we don't know how much of that, what we're seeing now, is attributable to the cases that were not known in those early days.
So moving forward, tracking the virus, the trends, what should states and the federal governments be doing?
I think they are doing, I think from the national level, I think a lot has been done to set up the framework that states are supposed to follow. But now that we're at the stage of community transmission, it's really not up to, the folks at national levels. This now, at the state level, that the governors really need to be aggressive about, trying to arrest transmission. Those ports of entries, those interstate boundaries, the testing rates, all of that needs to be aggressively pursued. I'm not sure that, I know that contact tracing is still going on, but that's something that really needs a lot of effort. I think that if we take testing to the people, as opposed to expecting expecting people to come to the test, I think we'll be able to get a better grip on what's truly happening. Right now, the testing is kind of prioritized for those who have symptoms, and that's not good enough. We should, at this point, be, particularly at state level, testing those that don't have symptoms. Take the test to the people and get those numbers up. Rwanda and Ghana have been quite aggressive about this and have, like you said in the earlier segment of this update, that they're doing pool testing where several specimens from various people are put into the same tube for testing. And if every contributor tests negative, then that's like another 5 or 10 people you don't have to test again. But if one of them tests positive, then you have to go back and do individual tests. So it's a very quick way to really ramp up your testing numbers. So I think testing is really the core of what needs to be happening now, so we can better understand what's truly happening behind the numbers that we see every day.
All right, we appreciate your time. Thank you so much and your insight, Dr. Kemp, and co-chair, the Health Sector Reform Coalition. Thank you for joining us on the program.
Thank you.
We have more on the COVID-19 updates when we return. Please stay with us. Welcome back. Still ahead of the Eid al-Kabir celebrations tomorrow, the chief imam of a central mosque in the state says that anyone coming for Eid prayers without the face mask and hand sanitizer will be barred from entering the mosque. The Muslim cleric disclosed this when our correspondent, Eitope, visited the central mosque to know their preparations ahead of the prayers tomorrow.
Amidst the COVID-19 pandemic, Muslim faithful in Imo State would join their counterparts in other parts of the country and across the globe to mark the Eid al-Kabir celebration. They will converge here at the Central Mosque in Owerri, the Imo State capital, for the Eid prayers. We are here at the Central Mosque to speak to the Chief Imam to know their preparations ahead of tomorrow's Eid prayers, at least to be sure that the COVID-19 protocols and other precautionary measures are observed.
We have been making a lot of emphasis in it, and we will not get tired to let our people know that yes, this COVID-19 is real. And the prophetic hadith has enjoined us to take measure, and that measure has been, been observance right from the time the disease came up. You can see right away in the mosque there, you can see some items that we use in sanitizing our hands, and the face mask, which is already been made mandatory for for the protection. So we have last Friday announced to the congregation that whoever wants to pray here should come with his face mask, and then the distance measure will be applied. We apply it, inshallah.
The Imo State COVID-19 Task Force will also be out tomorrow to monitor mosques and other fun spots to be sure that caution is not thrown to the wind regarding all the COVID-19 protocols. From the Central Mosque in Owerri, the Imo State capital, Eitope for COVID-19 updates.
Joining us right now via Skype is Dr. Osemeka Osokogu, a public health physician, consultant, National Institute for Health and Care Excellence, the UK. Thank you for joining us on the program.
Thank you for having me.
All right, I'd like to ask about the front lines in the United Kingdom and what we're hearing that in the UK, the chief medical officers are saying that the isolation time has been extended from 7 to 10 days.
Yes, so this is exactly what the message has been. And this is in response to the changing knowledge, the improved knowledge we have regarding the pandemic.
So in terms of this new normal, we're learning a lot of new things so far. How would you say that the government in the UK is handling things?
I will say that the government has handled this very well, and the government is quick to respond to changes in our knowledge of the pandemic. So I give an example. Of course, lockdown measures have been eased. So persons can go around within based on certain defined criteria. But also, if the situation were to change, if there were to be a second wave, the government is well equipped to rapidly respond to that second wave.
So also in adjusting to what it is right now, it's said that no one is safe until we are all safe. Do you think that there is international solidarity in the pandemic fight when you look at the race for vaccines, the treatment regimens, and all the information out there?
Yeah, so I happen to lead an international alliance that is working on pooling data across partners all over the world to respond rapidly to COVID-19 related health problems. But also, I am part of a couple of other committees that are focused on helping to develop vaccines. So what I would say is there is a whole lot of effort being devoted to the development of vaccines to fight this pandemic. And I would say progress is being made. unlike what would normally occur with vaccine development, this is going relatively fast. And of course, that is because several governments, several organizations, several institutions across continent have pooled their efforts together to respond to this.
All right, we'd like to thank you. Wish you all the best, of course, as you gather data and as we see a quick end to the pandemic. Thank you so much, Dr. Semeka Osokogu, public health physician, consultant, National Institute for Health and Care Excellence. Thank you.
Thank you for having me.
Many countries across Europe have been reporting daily record increases in new COVID-19 cases, prompting fears of a wider surge across the continent. This is going on just as the U.S. state of Texas surpassed New York, which was for months the epicenter of the virus outbreak in the U.S. Here's a global update.
The United States reached a grim new milestone on Wednesday, surpassing 150,000 coronavirus deaths, the most of any country in the world, nearly a quarter of the global death toll. More than 10,000 Americans have died in the last 11 days. New York, which was for months the outbreak epicenter in the United States, has been overtaken by Texas, which is now counting over 418,000 total cases, compared to New York's more than 413,000, according to Johns Hopkins University data.
Do you think that's anxiety that is a little... I think so.
With almost 485,000 cases, California is still leading in total cases. Overall, the U.S. has recorded over 4.4 million cases and 150,716 deaths. Addressing the people of the UK, Prime Minister Boris Johnson said it's absolutely vital as a country we don't delude ourselves that somehow we're out of the woods or this is all over, because it isn't all over. Adding that the resurgence of the virus was visible in some countries in Europe and in the US, and that people must continue to follow social distancing guidelines to avoid a second wave. In Brazil, a majority of coronavirus strains were traced to 3 virus groups from Europe, according to researchers. They estimate that over 75% of the strains fell under groups from Europe by sequencing 427 genomes found in Brazil around late February and early March. The death toll in Brazil surpassed 90,000, and the number of people testing positive went over 2.5 million. Vietnam has advised tens of thousands of people who visited the city of Da Nang to report to disease control centers, as 9 new coronavirus cases were confirmed and the country scrambled to contain its first outbreak in over 3 months.
Don't forget the safety measures to keep the virus at bay. You can also take a look at our website. It has the latest updates on the pandemic. All you need to do is log on. That is channelstv.com, and access the news on the pandemic. Of course, several other news, politics, business, sports from Africa and the rest of the world. Thank you for watching. I'm Millicent Walker. Stay healthy.